I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist, and a question I get all the time is it safe to take hormone replacement therapy? What about the increased risk for breast cancer later in life? This is a made-up case based on real patients I've seen in my high-risk breast clinic, which will tell you all the answer. A 47-year-old came to see me because she had a family history of breast cancer and she had previously had one biopsy. She also had extremely dense breasts, and this is what her mammogram looked like. Her PCP recommended that she come see me in my high-risk breast clinic so we could talk about her risk for breast cancer and possibly do genetic testing. Her maternal aunt had been diagnosed with breast cancer at the age of 48, and based on that, she did meet criteria for genetic testing, and we went ahead and tested her. She also had a prior history of a benign biopsy that didn't show any hyperplasia or increased cell growth in that area, or atypia, any atypical cells in that area. Her genetic testing results were negative, but showed that her breast cancer risk score was 31.3% and her Tyrer-Cuzick was 28%. Both of those scores indicated that she was above the 20% risk threshold to be considered high risk and to be followed in a high-risk breast clinic. We talked about HRT and about how if she chose to do estrogen and progesterone, it would increase that risk by about 28%, meaning her risk would go up from about 30% to about 40%. And if she chose to take HRT, which only contained estrogen, then her risk would probably not go up. She was having significant brain fog and hot flashes and depression and wanted to try HRT, but she also agreed to start doing breast MRIs, which will really benefit her because her breasts are also extremely dense. And we agreed that we would do a mammogram with an ultrasound as needed, as well as a breast MRI alternating every 6 months, and keep following her in our high-risk breast clinic, and that if she developed any breast symptoms at all, like pain, discharge, new skin changes, a lump, anything that concerned her, she would come and see me right away.